I used to think my uncle was the healthiest man his age, 78, still walking a mile every morning, reading the paper without glasses, and never missing his Wednesday chess games. But everything changed the day his doctor looked at him and said, "Henry, when was the last time you looked at your gums?" That question sent us spiraling into a reality we never saw coming. 3 seemingly harmless hygiene mistakes had been silently wrecking his health from the inside out. No pain, no symptoms, until it was almost too late, and he's not alone. Across the country, thousands of older adults are unknowingly making the same silent, dangerous mistakes every single day. These aren't just grooming habits, they're warning signs. Red flags that your body is screaming at you, hoping someone's paying attention. In the next few minutes, you're going to hear 7 personal hygiene mistakes that doctors notice immediately in elderly patients. What you learn today could save your life, or the life of someone you love. Because number 4, that one nearly killed my uncle, and chances are, you've been ignoring it too. Stay with me. This isn't just about hygiene. It's about dignity. It's about independence. And it's about catching the small things before they turn into tragedies. My Aunt Lorraine used to say, "At my age, a little bleeding when I brush is normal." She smiled when she said it, half joke, half denial. Lorraine is 70, a retired teacher with a sharp wit and a shelf full of crossword trophies. But behind that smile, something far more serious was building. It started with her gums. She noticed they bled more easily. Her breath was off, despite daily brushing. Still, she chalked it up to just getting older. But during her annual physical, her cardiologist noticed something off: her heart rate, her valve behavior, her blood work. After further testing, the real cause came to light: a severe inflammation in her heart valves caused by bacteria that had traveled from her mouth into her bloodstream. Lorraine was shocked. "I thought dental issues were just about bad teeth or dentures," she told me, tears in her eyes. "I never thought it could affect my heart." What she didn't know, and what so many seniors don't, is that gum disease can do more than ruin a smile. According to geriatric researchers at Harvard Medical School, seniors with untreated gum disease are up to 3 times more likely to develop life-threatening heart conditions. Why? Because bacteria in inflamed gums can enter your bloodstream, triggering systemic inflammation. That inflammation puts pressure on the heart, increasing the risk of heart attack, stroke, and even dementia. It sounds terrifying, but here's the good news. It's preventable. Start by checking your toothbrush. Is it frayed, over 3 months old? Toss it. Better yet, invest in an electric toothbrush. It removes up to 62% more plaque than manual brushing, according to the University of Pennsylvania Dental School. Brush twice a day, 2 full minutes each time. Set a timer if you need to. Floss every single night. No excuses. And never skip dental checkups, even if you have dentures. Your mouth still holds bacteria that can threaten your heart and brain. Look out for warning signs: bleeding gums, swelling, tenderness, chronic bad breath. These aren't just age-related annoyances. They're your body sending an SOS. Aunt Lorraine was lucky. She caught it just in time, but many don't. So, let me ask you, when was the last time you flossed? When was the last time you replaced your toothbrush? When was the last time you looked inside your mouth and actually listened to what it was trying to tell you? Clarence used to joke that after retiring from the Postal Service, he finally earned the right to skip showers. "If I'm not sweating, why wash?" he'd laugh. At 77, he was sharp, stubborn, and proud, still walking his dog every morning and tending his backyard tomatoes like a pro. But behind that routine was a quiet mistake that almost cost him everything. During a checkup for mild back pain, his doctor noticed something unusual: darkened patches on his lower back and shoulders. Clarence brushed it off as winter dryness, but further tests told another story. Those patches were signs of early-stage kidney disease. You see, Clarence only bathed once a week, not because he was lazy. He said his skin felt dry in the winter, and he didn't want to strip the oils. But that infrequent bathing masked the early symptoms: discoloration, subtle swelling, changes in skin texture. His largest organ had been sending out distress signals that no one could see. Dermatologists at the Mayo Clinic have confirmed that many internal issues, diabetes, liver dysfunction, heart failure, first show subtle signs in the skin. And when seniors bathe less frequently, those signs go unnoticed for far too long. What's worse? Nearly 40% of undiagnosed medical conditions in older adults could have been caught sooner if someone had just paid attention to the skin. So, what should you do? First, establish a bathing routine, at least 3 times a week, even if you're not sweating. Use a gentle, fragrance-free soap to avoid drying out your skin. Right after bathing, apply moisturizer while your skin is still damp. That helps lock in hydration and keeps your skin resilient. Then, inspect. Look closely. Are there dry, flaky patches, discoloration, persistent itchiness, a rash that doesn't go away? These aren't just cosmetic annoyances. They could be signs of something deeper. And don't ignore areas you can't easily see. Ask someone you trust to help check your back, your legs, your scalp. Clarence's story has a better ending than most. Thanks to a sharp-eyed doctor, his condition was caught early. He changed his habits. His treatment started. And today, he never skips his baths or his skin checks. He told me, "I used to look at bathing as a chore. Now, I see it as a check-in with my body." Beatrice always had beautiful hands. Even into her 80s, she'd paint her fingernails soft pastels, just like she did when she taught piano to neighborhood kids. But her feet? That was another story entirely. She hadn't let anyone see her toenails in over 5 years. "I just thought it was aging," she said softly. "They got thick, yellow, kind of ridged. I didn't want anyone to see how bad they looked." Beatrice, like many seniors, assumed her nail changes were just a natural part of getting older, so she stopped wearing sandals, stopped getting pedicures, and started ignoring her feet entirely. But what she didn't know was that those thickened yellow nails were more than just a cosmetic issue. They were a signal, a serious one. When she finally visited a podiatrist because of foot pain that wouldn't go away, the doctor immediately diagnosed her with a long-standing fungal infection. That wasn't the shocking part. What stunned everyone was what came next. Further testing revealed that her immune system was severely compromised. Her body hadn't been fighting off the infection like it should have. The culprit? A previously undiagnosed blood disorder, serious but treatable if caught early. And it all started with her toenails. According to the American Academy of Dermatology, nail abnormalities can indicate over 20 systemic diseases, including thyroid disorders, anemia, diabetes, and heart disease. In patients over 65, nearly 30% of hidden health conditions are first detected through nail exams. So, the question is, when was the last time you looked at your nails? Really looked. Here's what to do. Trim your nails straight across with slightly rounded edges to prevent painful ingrowns. Keep them clean and dry. Wear breathable shoes and change your socks daily. But most importantly, pay attention. Are your nails brittle, yellowed, thickened, or ridged? Do they have dark streaks, or are they lifting from the nail bed? These aren't just signs of wear. They might be your body's way of warning you. Beatrice told me later, "I wish I hadn't waited until they hurt. I wish I hadn't been embarrassed." So don't be. Because your nails might be small, but they can speak volumes about what's happening inside your body. And sometimes, listening to them can save your life. This is the one that no one wants to talk about. Not at the dinner table, not at the doctor's office, not even with family. But it's also the one that nearly killed my Uncle Henry. It started with little things. He began avoiding long drives, stopped going to church, and started carrying a folded towel in his coat pocket. When I asked why, he brushed it off. "Just being cautious," he said. But the truth was darker. Henry was struggling with incontinence. Embarrassed, ashamed, and proud, he tried to manage it quietly. Paper towels, extra underwear, frequent changes of clothes. No one knew, until the day I noticed he winced while sitting. I convinced him to let me take a look. What I saw shook me. Raw, red skin around his thighs, signs of sores, and the early stages of infection. When we finally saw the doctor, he didn't just find skin irritation, he found signs of advanced prostate disease, missed for months because my uncle had hidden his symptoms instead of treating them. Urologists at Johns Hopkins warn that over 50% of seniors deal with some form of incontinence. But the most dangerous part isn't the leakage. It's the silence. Untreated incontinence can lead to skin infections, painful sores, social isolation, and in many cases, it hides underlying conditions like bladder cancer, prostate disease, or neurological decline. So, here's what you need to know. If you're experiencing leakage, urgency, or accidents, even occasionally, you are not alone. And more importantly, you are not broken. Here's what to do right now. Talk to your doctor. They see this every day. There's nothing embarrassing about asking for help. Use the right products, not tissues, not toilet paper. Use absorbent undergarments designed for incontinence. They're safer, more discreet, and protect your skin. Clean properly and promptly. After any episode, wash gently and apply barrier creams to prevent breakdown. Recognize the signs. Are you planning outings around bathroom availability? Avoiding sleepovers? These are your body's quiet cries for attention. Uncle Henry later told me, "My pride almost cost me my life. I should have spoken up earlier. I thought I was managing it. I wasn't." Incontinence doesn't make you weak. Hiding it, though, can make you vulnerable to far greater harm. Don't suffer in silence. Don't let fear of judgment stop you from living fully. Because treating the issue openly might just be the thing that saves your independence, or your life. If you've ever used a cotton swab to clean inside your ears, you're not alone. In fact, Patricia, a 71-year-old retired librarian from Washington, used to keep them in every bathroom drawer. "I like that clean feeling," she told me, and nobody ever said it was wrong. Until the day she felt a sharp pain while cleaning her ear, so sharp she nearly fell over. By the next morning, she couldn't hear anything from her left side. She thought it was earwax, maybe a cold. But when the pain spread to her jaw and neck, she went to the ER. The diagnosis: a punctured eardrum and a spreading inner ear infection that had already reached nearby tissue. The worst part? It could have been completely avoided. Doctors specializing in geriatric ear health report that nearly 40% of ear injuries in seniors are caused by improper cleaning, especially by inserting cotton swabs too deep into the ear canal. Here's the truth no one tells you. Your ears are self-cleaning. Wax moves outward naturally as you chew and talk. Inserting anything smaller than your elbow, yes, your elbow, can damage delicate tissues, push wax further in, or introduce infection. So, what's the safe way to care for your ears? Never insert swabs, keys, hairpins, or any small objects into the ear canal. Clean only the outer ear using a warm, damp washcloth. If you feel a blockage or buildup, use over-the-counter wax softening drops as directed. Or, better yet, let a doctor handle it. Watch for signs like pain, discharge, fullness, or hearing changes. These are red flags. Patricia now lives with partial hearing loss in her left ear. She uses a hearing aid. She told me, "It's humbling, one little habit, and I live with the consequences every day." But she also tells everyone she knows, neighbors, friends at her book club, even strangers at the pharmacy. If it feels good, that doesn't mean it's safe. You only get 2 ears. Treat them like treasure. So if you're still using cotton swabs in your ears, stop today. Not tomorrow, today. Your hearing is too precious to risk for the sake of a quick clean. Raymond had always taken pride in doing things himself. At 76, the former factory worker from Illinois still insisted on mowing his own lawn and climbing up on ladders, even when his children begged him not to. But his feet? That was another story. For years he ignored the cracks on his heels, the dry skin around his toes, and the small cuts that never seemed to heal. "They've looked like that for a decade," he shrugged. Nothing new? Until one day, during a routine checkup, his doctor noticed a faint bluish tint around his toes, and a sore that looked older than it should. Tests revealed the truth. Raymond had type 2 diabetes, likely undiagnosed for years. According to the American Podiatric Medical Association, up to 85% of diabetes-related amputations could be prevented with proper foot care. Your feet are full of nerve endings and tiny blood vessels. Any changes, cuts that don't heal, numbness, tingling, discoloration, can be the first visible signs of circulatory or neurological disease. So, how do you care for your feet properly? Wash and thoroughly dry your feet every day, especially between the toes. Inspect daily for cuts, swelling, color changes, or sores. Use moisturizer on dry skin, but never between toes. Too much moisture there encourages fungus. Wear clean, breathable socks and supportive shoes that fit well. And most importantly, see a podiatrist regularly, even if your feet seem fine. Raymond said it best. "I thought rough feet were just part of getting old. I didn't know they were trying to warn me. But there's another silent culprit stealing hygiene from inside the body: medications. Let me tell you about Barbara. She's 67, a retired nurse from Florida, always tidy, always elegant. But a few months after starting a new prescription, her daughter noticed something strange, a sharp, sour body odor. Barbara was devastated. She bathed daily, used perfume. Nothing worked. She blamed herself. "I thought I was just getting old and smelly," she said quietly. But her doctor saw it differently. He immediately ordered blood work. The odor wasn't from poor hygiene. It was from liver toxicity, a rare side effect of her medication that was slowly damaging her organs. Pharmacologists from the American Geriatric Society confirmed that nearly 40% of adverse drug reactions in seniors first appear as changes in hygiene: dry mouth, body odor, skin issues, or unusual sweating. So, how do you protect yourself? Track any hygiene changes after starting a new medication. Keep a simple journal: date, medication, symptoms, side effects. Report everything to your doctor, even if it feels small or embarrassing. And never adjust your medication dose without consulting a healthcare professional. Barbara's liver damage was caught early, but many aren't as lucky. What you smell on the outside, she told me, could be something serious on the inside. So the next time you notice something different, odor, dryness, excessive sweat, strange patches, don't ignore it. Your body is speaking loudly. The question is, are you listening? When I look back now, I can't believe how close we came to losing my Uncle Henry. Not because of some terrible accident or an incurable disease, but because of silence, because of shame, because of 7 small mistakes that didn't feel like emergencies until they became one. After his diagnosis, Henry changed everything. He replaced his toothbrush, started using proper incontinence products, switched to fragrance-free soap, and for the first time in years, he let a nurse examine his feet, his nails, and his skin without apology. "I thought I was doing fine," he told me one morning over tea, "but I wasn't taking care of myself. Not really, I was just hiding what I didn't want to deal with." That's the heartbreaking part. These 7 hygiene mistakes aren't just habits, they're blind spots. And in older adults, those blind spots can hide some of the earliest warning signs of life-threatening issues: oral infections that strain the heart, skin symptoms that signal kidney failure, nails that whisper the truth about your blood, feet that know before you do that diabetes is coming, medication and side effects that you blame on yourself until it's too late. But here's the good news. Every single one of these mistakes is fixable. Every warning sign is a chance to catch something early. Every small change is an act of self-respect. This isn't just about staying clean. It's about staying independent, staying present, staying alive. So please, if you're over 60 or love someone who is, take action today. Don't wait for a doctor to spot it first. Don't wait until pain or infection forces you to listen. Inspect your body. Replace that old toothbrush. Talk to your doctor about things you've been too embarrassed to say. Start the conversation with someone who might be struggling silently, because sometimes what seems like a small hygiene issue is your body's first cry for help. And if you answer it now, you might just buy yourself not just more time, but better time. That's what we did for Henry, and that's what I hope, with all my heart, you'll do too. If this story resonated with you, don't keep it to yourself. Share it with someone who needs to hear it. It could save their dignity, their independence, or even their life.